How to treat and cure bladder cancer. Bladder cancer is a disease in which malignant, cancer, cells form in the tissues of the bladder. Smoking can affect the risk of bladder cancer. Signs and symptoms of bladder cancer include blood in the urine and pain during urination. Tests that examine the urine and bladder are used to help detect, find, and diagnose bladder cancer. Certain factors affect prognosis, chance of recovery, and treatment options. Bladder cancer is a disease in which malignant, cancer, cells form in the tissues of the bladder. The bladder is a hollow organ in the lower part of the abdomen. It is shaped like a small balloon and has a muscular wall that allows it to get larger or smaller to store urine made by the kidneys. There are two kidneys, one on each side of the backbone, above the waist. Tiny tubules in the kidneys filter and clean the blood. They take out waste products and make urine. The urine passes from each kidney through a long tube called a ureter into the bladder. The bladder holds the urine until it passes through the urethra and leaves the body. There are 3 types of bladder cancer that begin in cells in the lining of the bladder. These cancers are named for the type of cells that become malignant, cancerous. Transitional cell carcinoma, cancer that begins in cells in the innermost tissue layer of the bladder. These cells are able to stretch when the bladder is full and shrink when it is emptied. Most bladder cancers begin in the transitional cells. Transitional cell carcinoma can be low-grade or high-grade. Low-grade transitional cell carcinoma often recurs, comes back, after treatment, but rarely spreads into the muscle layer of the bladder or to other parts of the body. High-grade transitional cell carcinoma often recurs, comes back, after treatment and often spreads into the muscle layer of the bladder, to other parts of the body, and to lymph nodes. Almost all deaths from bladder cancer are due to high-grade disease. Squamous cell carcinoma, cancer that begins in squamous cells, which are thin, flat cells that may form in the bladder after long-term infection or irritation. Adenocarcinoma, cancer that begins in glandular, secretory, cells that are found in the lining of the bladder. This is a very rare type of bladder cancer. Smoking can affect the risk of bladder cancer. Risk factors for bladder cancer include using tobacco, especially smoking cigarettes. Having a family history of bladder cancer. Having certain changes in the genes that are linked to bladder cancer. Being exposed to paints, dyes, metals, or petroleum products in the workplace. Past treatment with radiation therapy to the pelvis or with certain anti-cancer drugs. Taking Ristolochiafangji, a Chinese herb. Drinking water from a well that has high levels of arsenic. Drinking water that has been treated with chlorine. Having a history of bladder infections, including bladder infections caused by Cystosoma hematobium. Using urinary catheters for a long time. Symptoms: blood in the urine, slightly rusty to bright red in color. Frequent urination. Pain during urination. Lower back pain. Tests that examine the urine and bladder are used to help detect, find, and diagnose bladder cancer. The following tests and procedures may be used. Physical exam and history. An exam of the body to check general signs of health, including checking for signs of disease, such as lumps or anything else that seems unusual. A history of the patient's health habits and past illnesses and treatments will also be taken. Internal exam, an exam of the vagina and or rectum. The doctor inserts lubricated, gloved fingers into the vagina and or rectum to feel for lumps. Urinalysis, a test to check the color of urine and its contents, such as sugar, protein, red blood cells, and white blood cells. Urine cytology, a laboratory test in which a sample of urine is checked under a microscope for abnormal cells. Cystoscopy, a procedure to look inside the bladder and urethra to check for abnormal areas. A cystoscope is inserted through the urethra into the bladder. A cystoscope is a thin, tube-like instrument with a light and a lens for viewing. It may also have a tool to remove tissue samples, which are checked under a microscope for signs of cancer. Biopsy, the removal of cells or tissues so they can be viewed under a microscope by a pathologist to check for signs of cancer. A biopsy for bladder cancer is usually done during cystoscopy. It may be possible to remove the entire tumor during biopsy. Bladder cancer treatment. Your bladder cancer care is customized to include the most advanced therapies, advanced surgical and reconstructive procedures, laparoscopic robotic surgery, conformal 3D and IMRT radiotherapy, immunotherapy, including Bacillus calmette-guerin, BCG. Latest chemotherapy options. Chemotherapy. Chemotherapy plays a major role in the treatment of bladder cancer that has spread, metastasized, to the lymph nodes, lungs, liver and other parts of the body. In these patients, chemotherapy is the frontline treatment. Radiation therapy. Although surgery is the frontline treatment for bladder cancer, radiation treatment has a role in certain patients. Immunotherapy. Bacillus calmette-guerin, BCG, a bacterial organism used to treat tuberculosis, is the standard immunotherapy for superficial bladder cancer. Gene therapy. The most effective and least invasive treatment targeted to specific cancers. This personalized medicine approach sets us above and beyond most cancer centers and allows us to attack the specific causes of each cancer for the best outcomes.